Claire, I'm Shelby. I'm your student physical therapist. I'll be working with you today. Go ahead and have a seat.
All right.
So, did the doctors explain to you your son Jeremy's diagnosis?
A little bit, but I'm still kind of hazy on the details.
Okay, so a CT scan revealed that your son had a traumatic brain injury to his right frontal parietal area of his brain.
Okay.
And that is in like the frontal area of your brain, and then the parietal area is on the side. The frontal area of the brain is for motor control.
What is like moving and stuff like that?
Moving and weakness, strength, stuff like that. And the parietal area is for perception and sensation.
Okay.
So perceiving voices, tones, things like that.
Okay.
And so he sustained the injury from the traumatic force in the motor vehicle accident.
Right.
We see this a lot from motor vehicle accidents. It's one of the biggest things that we see. It's more common in males than females, just because males usually have higher risk-taking behaviors. And your son being 17 years old, that's an age where we see this very common as well. So the injury when he hit, he sustained his primary injury from the force of the trauma.
The initial force.
The initial force. And then there's also an injury from when he hit and then his brain would slosh and hit on the other side.
So like ricocheted?
Kind of like ricocheting. Think of it as like jello, like bouncing through like a shearing force.
Okay.
And we call this the counter coup injury. And sometimes this is actually worse, just because the initial force is focal, but when you hit and it shears like that, it can cause a more diffuse injury to the brain, more widespread.
Okay, that makes sense.
So this can lead to secondary injuries due to like brain swelling, ischemia in the brain, so like unable for blood to perfuse through the brain and circulate through the brain as well as it normally would, and things like that.
Okay.
So those are things that we are going to work as a healthcare team. So we're working with doctors, nurses, physical therapists, speech therapists, occupational therapists. It's going to take an approach of a lot of healthcare providers to provide help for your son. Traumatic brain injuries are very common. We see them in like 5.3 million Americans have brain injuries. We see it in, there's a peak of brain injuries in little children from child abuse. Late adolescence to early adulthood, where your son Jeremy is, and again, elderly is from fall risk and things like that.
Gotcha.
So you might be expecting to see your son is going to have some motor impairments, some weakness, some maybe neglect, and that's going to be on the opposite side of his body from where the force hit. So the injury is to the right side of his brain, but he's going to be experiencing motor deficits on the left side of his body, because in the brain the tracks cross, so the signal is from the contralateral side of the body.
I have no idea.
And so he might be experiencing weakness, neglect of that side of the body, paresis.
What do you mean neglect?
So he may or may not just kind of forget this side is there.
Okay.
So he will be able to still pick it up and use it, but he might forget that it's there.
So just kind of stop using it?
Yeah.
Maybe?
And like sometimes if things are on that side of his body, he might not notice them. He might, run into walls and things on the side of the body because he's just not aware that it's there.
Okay.
He might experience some inability to identify objects by touch because the parietal lobe was damaged and that's with perception and sensation. He might experience some decreased sensation. There's an area in the brain on the left side called Broca's area, and it has a corresponding area on the opposite side, on the right side, that controls nonverbal communication. So he might have lost the ability to understand nonverbal communication, facial expressions. He might speak monotone.
Oh, okay. I think I've noticed that already.
You might notice that he might be irritable, might have a lot of headaches, dizziness, fatigue, insomnia, other deficits such as those. We're basing his cognition off a Ranchos Los Amigos scale. It's a scale that the doctors use to identify his level of cognition since the injury. So it's in stages. So it's like the lowest you could be is if you were in a coma, and then the highest stage would be if you had full cognition.
Okay.
So your son was placed on mannitol, which is a drug that's going to just help improve circulation to the brain tissue to bring blood back to the area to promote healing. And in physical therapy, we're just going to be monitoring his vital signs, making sure they're okay, getting him up and moving, regaining that strength that was lost, and also preventing and treating any secondary complications that came from the injury. And we're gonna be working, like I said, with doctors, nurses, speech therapists, and it's gonna be a multidisciplinary approach to treating your son.
Okay, great.
Do you feel like you understand everything?
I think so. Definitely better now.
Okay. Do you feel like you can explain it to the other family members and to your son?
Yeah, I think so. I'll just tell him that he should, even though his injury was on the right, he'll have his problems on the left. We need to kind of cue him to use that, keep using that left side, and he needs to not freak out if he sees weakness or any of these symptoms that you've talked about. And I'll tell him to expect some sleep-related issues. And yeah, I'll just go off of that. Thank you so much. It's helpful.
You're welcome.